So today I will be going over and discussing the importance of proper patient admittance into the hospital. So we are a paperless hospital, and so I have up the patient that I've selected, her patient clipboard, which has all of her information, all of her medical records. So her signalment, you can see, is listed over here. She is 10 years, 7 months. She's 17.2 pounds, spayed female, and a Maltese mix. And we also have all of the owner's updated information as well. Now in here, we have all of her previous medical history from before we went paperless, and it's all scanned in. As attachments. Then you can see this was from when we had the paper charts. All of her examinations are written in here, vaccination history. And then the other side of the chart is also scanned in as well. And this contains all of her radiograph reports, any lab results we may have sent out or done in-house, you can see here. And that's important when considering her for a surgical procedure, to make sure we go all of her previous medical history. Now, every exam and workup we've done since we've gone paperless is in the computer. You can see we have the summaries, which has all of her examination notes. That'll have a preview up on this window. Any lab we've done has its own tab. All of her vaccinations are listed. And then you can check each previous exam when checking in a patient for surgery to make sure, are there any heart murmurs listed, any other concerns when putting her under anesthesia for the doctor to be made aware of if he or she has not been the last one to examine her. And of course they will also do a pre-surgical examination as well. So if we look at her last exam, we will see the doctor's notes. She has stage 2 to 3 dental disease, which is why we are doing the dental today. There's a mass on the left upper eyelid. And more importantly, she does not have any murmur or abnormal remarks for her heart and lungs. Her nervous system is normal. She did not find anything abnormal in her GI tract, lymph nodes, or nose and throat, which is all good things considering we are going to be putting her under anesthesia. And now when checking in a patient for the procedure, there are certain consent forms you need to have signed by the owner giving us permission to perform the procedures. So first we have the anesthetic waiver. And this lists all of her information. We will also take a best telephone number to reach her for today. It also has the patient signalment over here on the right side of the screen. And below here, we have a area where we will manually type in what procedures we're doing today, which doctor is going to be performing those procedures, and basically having the owner authorize that Dr. Reitz is going to be performing the dental and possibly removing an eyelid cyst, and that she understands the risks of anesthesia, and that she understands that the veterinarian and hospital staff will do everything in our power to prevent any of those risks, but that there are in fact risks. Also on here you can see that we have a section of intraoperative fluids and IV catheter, saying that this is required for all of our procedures done here. It helps the patient recover from anesthesia better, and it's also, the IV catheter can also be used to administer the medications used to sedate and then fully anesthetize the patient. Also, we have pain and comfort medication. We do require post-operative analgesia, so we'll send home medication with the owner. Also, we may give some medication while the patient is still here recovering from anesthesia to get ahead of the pain. Also, we have a section for an Elizabethan collar for an ovariohysterectomy or a neuter or a tumor removal. We require them going home with the collar to prevent the patient from tearing out the stitches, causing an infection, or, you know, causing an infection or damaging the area that we have performed surgery on. Now, lower in the waiver, we also have a requirement for pre-anesthetic blood work, which includes a CBC and a chemistry, checking all the liver and kidney values, making sure nothing, there are no abnormal values, because anesthesia is metabolized through the liver and kidneys. We want to make sure they're functioning well. If we do find anything that would suggest the patient is not suitable for anesthesia, we would not do the procedure today. And that's why we always require pre-anesthetic blood work before we do the procedure. Now, if they had just had a routine panel done a couple of months ago, we wouldn't necessarily require them to do blood work that same day, so soon after. But if they haven't had any recent blood work done, we definitely do a pre-anesthetic blood work. Also checking the hematocrit, total proteins. And then there's also a part of the anesthetic waiver that goes over any laser surgery consent. We do have a CO2 laser which cauterizes as it cuts instead of using a scalpel. This is more for a neuter or ovariohysterectomy. For a dental procedure, we don't necessarily go over this with the owner. But since we are potentially removing an eyelid tumor, we would go over this with the owner, saying if you did want us to take off the eyelid tumor, the veterinarian would use the laser to cauterize and just cut the tumor off. Instead of maybe using a scalpel, it could be quicker and easier. We also have a microchipping section as well. And then we have the owner electronically sign using one of these pin pads. And then we'll save the anesthetic waiver, and that will be permanently on her patient clipboard. Now after that, we have the dental waiver. So for the dental waiver goes over pretty much everything we need to do for the dental procedure, saying that you're authorizing dental radiographs to be taken, which we do for every dental procedure, authorizing extractions if needed. And then we also have a section, I wish to be contacted before any further procedures. No matter what our doctors contact the owner before, if they find any teeth they need to take out not previously discussed, they will always try to contact the owner. And if there is also a section if I cannot be reached, because there's always the chance that the owner will not be around their phone to pick up the call. If we just can't get in contact with them, if they okay all procedures needed for my pet's health or do not okay any further procedures. And that's a very important thing to discuss with the owner, because if we find a molar or premolar that's infected and abscessed and needs to come out, then if we cannot reach the owner and they do not authorize any further procedures without being contacted, we can't extract the tooth, which is needed to be done. So it's always good to discuss with the owner things like that. We also offer a dental sealant called Sanos. It lasts for 6 months, and basically is applied on the subgingival gum line of the patient, and the owner does not need to clean the teeth for 6 months after the dental procedure is done, and then we offer them to come back and we can show them some tips and tricks on cleaning the teeth at home. And then as you can see, she is signed again. And then if there's any other further questions or concerns, we can also write that on there, like if she wanted the anal glands to be expressed, any extra ear cleaning, things like that. The anesthetic form is very important when performing surgery for the technician to write down everything that's going on. It's pretty much a story of how the procedure goes. So here we have our anesthetic waiver. The patient's name goes up here. We have a time, mucous membrane color, CRT, pulse, respiration, SpO2, whether we are using isoflurane or sevoflurane, temperature and blood pressure sections, and then we have where we can list everything. Also down here we have the total volume of fluids infused. We also have the fluid rate written as well. And we'll do the duration of the procedure. We have a pain assessment scale, which we'll do after the patient wakes up. We do 2 different pain scores, 2 different times. We have the recovery after the procedure is done. Do they wake up really rapidly? Is it smooth? Does it take them a longer time to wake up? Or is it called a rough wake up where they can become very agitated, vocal, very disoriented? And down here we also have an important box that shows intubated, procedure start, procedure finish, extubated times. And that's an important part to write down so that we can figure out when the procedure started. If there's any questions about what happened, we know when they were intubated, how long it took for the procedure to get started, how long the procedure was, and then when they were extubated. And then we also have a signature for the veterinarian doing the procedure, and then the technician also who was monitoring the anesthesia. I'll be discussing cage cards or other forms of patient identification to make sure that the proper patient is getting the correct surgical procedure done. So as you can see, the kennels are all labeled with a number. So this is kennel 10, and on here we'll go ahead and write Sadie, and then we'll write how much she weighed that morning and that she's getting a dental. We can also put the her temperature for the morning, any other concerns, if she's a caution, if we need to muzzle her. Along with that, each cage number will also be posted on what we call the whiteboard in our paperless system, and I will show you that next, and that we will put each kennel number with the proper patient in their alerts category, so we can look on the whiteboard and see, okay, we know that Sadie's in kennel 10. In case something happens to her cage card, we'll still know what patient that is. Another form of patient identification is we have a boarding treatment sheet. This can also be used for patients that are hospitalized. It has their name, owner's name, when they dropped off, any medications they need, the directions, and then it has here parts where we can write when we fed them, how much we fed them, how much medication they've gotten. Now another important aspect of admittance of a patient is any laboratory forms you need to use. Now we run a lot of our blood work in-house, and this is where we'll run it. We have our Catalyst and ProCyte and also a set of you, but I wanted to show you some paper forms we also have. This is an example of we were going to be sending out a blood panel prior to when they were coming in for the surgical procedure, and you can see we'll fill out doctor, client, pet name, all the other signalment information, and then it has all the different profiles we can also select that we wanted to run on the patient. Now here we have already run Sadie's blood work. So we have her CBC, her white cell count is normal, and it looks like her red cells are also normal. We have a little bit of an elevation of NPV, but that will be brought to the doctor's attention, and then we'll look at her chemistry. Her alk phos and total proteins are slightly elevated, but we can look back in her history to see if that's been an ongoing issue or if this is a new development, and then we'll definitely bring that to the attention of the doctor. And then it also looks at her BU and creatinine ratio, all her electrolytes, and everything else looks to be within the normal parameters. Another important form we also have is the surgery report. Mostly the doctor will put in all of the drugs they've used, any go-home instructions for the technician to go over with the client. But we'll see that we have all of the lab work pertinent to the procedure inserted into the note. We'll see their pre-surgical exam notes as well. And then the information regarding what catheter was placed, the rate of fluids they wanted infused, what pre-anesthetic drugs they used, what induction drugs they used, if they used any local anesthetics, maintenance drugs, if we needed to do any reversal drugs, and then any post-operative medications. It looks like we wanted to do Metacam or Minoxidil. And then she'll write her surgery notes as well for the procedure. You can also see how these are stored in our system. Every medical note is a different color, so we can easily pick out what we need to look at. The surgery report's in orange. All of the anesthetic and procedure waivers are in red. And then her, the exam notes are in green. So since we did take out teeth during the dental procedure, I will now be going over discharge instructions for the client. First and foremost, when they come home from anesthesia, from being under anesthesia, they may be very whiny, disoriented, and that's normal dysphoria from the anesthetic. We want to introduce everything slowly into their system. They were on IV fluids throughout the procedure, so they are not necessarily dehydrated. If when you get a little bit after they get home, we always tell them to just offer small amounts of water. We want to introduce everything slowly. Small amounts of very soft food when teeth have been extracted. We don't want any hard food pulling at the suture sites in the mouth. If they see any pinkish tinge to the water, that's normal when extractions have happened. Active bleeding, they definitely need to give us a call because that is abnormal. We will always send home pain medication. So for this particular patient, we sent home gabapentin and an antibiotic because the mouth was pretty dirty and gums were very inflamed, teeth were not in great shape. So with the gabapentin, we want to start that night the patient goes home to get ahead of the pain. Gabapentin is safe to give on an empty stomach, but we always encourage giving with food so that we may prevent any GI upset. The antibiotic needs to be started the morning after. An antibiotic does need to be given with food. If an antibiotic is given on an empty stomach, just like with us, it can cause GI upset, vomiting, ulcers if that is allowed to happen multiple times. The gabapentin is a very safe drug. It can be given alongside the antibiotic. Those two will not have any negative interactions, but we always tell clients to watch for any GI upset. If they see any vomiting or diarrhea, to give us a call. Maybe we need to switch to another antibiotic. It may be that that particular medication does not sit well with the patient, and that has happened before. We always tell clients we want to see them back if they're concerned about anything. The normal recheck time is 10 to 14 days to make sure that the incision sites have healed well and they can have the go-ahead to start with their normal food. A side effect of gabapentin can be some sleepiness or drowsiness, and that's normal. Like I said, we always encourage clients to give us a call if they have any questions about the medication, but we always go over the side effects of every medication given. So today I'll be demonstrating how to restrain a patient for a jugular, cephalic, and saphenous venipuncture. So I have our patient here, Louie, and for the jugular there's a couple different ways you can hold them. Usually they are sitting. You sit. Either you can be behind them or to the side. I find that with larger dogs being behind gives you a little bit more control. I'll have my legs right beside his body, and I'll take the collar and leash and gently lift his head up. And then a coworker could come and occlude the vein and then draw blood from his jugular on either right or left. Next would be the cephalic. He's perfectly good in this position to draw from that leg as well, so I can crouch behind him or next to him. Having control of his head, I'll go ahead and put my hand behind his elbow, extending the forelimb, putting my thumb medially, rolling out laterally, and then you can see the vein will start to pop up. Now for the saphenous, we normally draw laterally on the dog. So I'll go ahead and have him stand up. This can either be lateral or standing. So I will go ahead and have my right arm around his head and neck, and then I will go ahead and hold off, and then you can see it'll start to pop up right along his outer thigh. Today I'll be demonstrating how to move a dog safely in and out of a kennel. First thing is to make sure you have a slip lead on, just so that if they, for some reason, the leash isn't attached to the collar or the collar is too loose, they can't slip out. So I have the slip lead on. I'm going to go ahead and open the kennel. Come on, Louie. And you lead them in. Once they're in, you slowly take the leash off. I always just make sure they're not going to run out. Lock it. And then, once you take them out, I always make sure that I have the leash ready to go around their head, so if they come out super fast, so you can kind of catch them. There he comes. Today I'm going to be demonstrating how to safely put a muzzle on a dog. There are a couple different kinds of muzzles, a basket or a cloth, and it really just depends on the situation. I think I'll be able to use a cloth with him. I usually try to gauge how big the muzzle is, from what you can see. If they're being really aggressive, you can put on a larger one and tighten it. So you have someone holding, and you want to make sure the smaller part of the muzzle goes on the nose. I'll come around from behind and just scoop, clip, and then you can tighten it according to how big or small their head is. Yeah, I'll be demonstrating how to fit an Elizabethan collar on a dog. So I actually have one that is called a calmer collar. Some dogs actually prefer it because it doesn't make as loud of a noise when it hits a wall or so as you can see, it's velcroed, and there's also hooks to go through a collar, or for a collar to go through here. Can you sit? So when fitting for an e-collar, you want to make sure that it's tight enough that it won't slip off, and that it is long enough to make sure their nose can't get to a site. As you can see, she won't be able to reach if she was spayed or had a tumor removal. And it's tight enough that it won't slip off, but I can fit in 4 fingers to make sure that it's not too tight around her neck. So today I'll be demonstrating how to do an examination on a dog, take a TPR, and give them an ASA grade. So first what we look at is the gums. So the gums are nice and pink. I'm going to press, get a CRT time, and it refills really quickly. They're moist, they're not tacky or dry. And then to listen for the heart rate, you count the beats for 15 seconds and then multiply by 4. And when listening for the heart rate, if they're panting, that can make it a little muffled to hear. You can gently press up on their lower jaw or have your assistant hold their mouth closed. And also what I'm going to be doing is feeling his femoral pulse. So there should be a corresponding pulse to every heartbeat. That can give you an indication if there's an arrhythmia, a skipped beat, or if the pulse is weak or feathery. So his heart rate was 88, which is normal. He's a very fit dog. His weight is great. He has a nice tuck in his belly. Next I'm going to be listening for a respiratory rate. There are 9 quadrants of the lungs, so I'll just move my stethoscope to each quadrant to listen for equal breath sounds. So I didn't hear any wheezing or crackling, nice clear sounds. He was taking good deep breaths. And next we're going to be taking his temperature. So I have a thermometer here. I'm going to first put on a probe cover and use some lube. And his respiratory rate was 20. You do the same thing. You count the breaths for 15 seconds and then multiply by 4 for a minute. Great, 100.9, which is normal. So I would give him an ASA grade of a 1, which means minimal risk for any health issues. I didn't find anything abnormal on exam. He's a normal, healthy patient. Yeah. That's it. Today I'm going to be demonstrating how to take a physical examination on a feline patient. First I'm going to be looking at her overall body condition score, any physical abnormalities I may find. She is just slightly overweight. We look at her eye is nice and clear. She does have some dental tartar. Her ears are nice and clean. Other than her slight overweight, I don't see anything physically abnormal so far. Now I'm going to listen to her heart and lungs. And to take a heart rate, you count the heartbeats for 15 seconds and then multiply that by 4 for a minute. So I'm getting 100, which is in the normal range. Now I'll be listening to the 9 quadrants of her lungs. To take a respiratory rate, you do the same thing as the heart rate. You listen for her breaths and then for 15 seconds and then multiply that by 4 for a minute. So for her respiratory rate, it was a little elevated, 32. So that could be because she's nervous. Any could be underlying issues. We would definitely do some blood work if we were going to be putting her under anesthesia. So now I'll take a temperature. Now I'll be taking a temperature. .99, which is in the range of normal for them. So overall, I would give her ASA grade of a 2 because she is slightly overweight. We want to take some precautions of putting her under anesthesia. So today I'll be demonstrating how to draw blood from the cephalic vein on a dog, and I'll have my coworker here restrain and then occlude the vein. So the vein runs right along the top of their forelimb. So I'll go ahead and spray some alcohol. And I'm going to be using a 25 gauge needle on a 1 cc syringe. I'll get the top off. And when drawing blood, you always want to make sure the bevel of the needle is facing up. So I'll go ahead and use my thumb to stabilize the vein. And then I'll use my plunger to pull back, and when I get the desired amount, I'll put pressure, and then my coworker will put pressure on the vein. Today I'll be demonstrating how to draw blood from a jugular vein for a dog. So first I have my coworker restraining, holding the head up, exposing their neck. The first thing I'm going to do is put some pressure on the thoracic inlet to visualize the vein. I'll feel it right here. Put some alcohol there. It's actually like right there. So my bevel is facing up, and I'm going to just go ahead and insert the needle into the vein. And when I have the desired amount in my syringe, I'm going to go let off, hold off, and then my coworker will apply pressure, and I can go ahead and put this into any tubes I need. Today I will be demonstrating how to draw blood from the saphenous vein of the dog. For dogs, we draw it laterally, cats medially. So they can either be in a standing position or on their side. She's doing great standing, so we're just gonna draw it like this. I have my coworker holding off, and you can see the vein really nicely. So I have a butterfly. You can also use a syringe. I'll take off the end of that, get my syringe ready. And as with every other blood draw, you always want to make sure that your bevel is facing up. Spray some alcohol. You can see the blood is flowing nicely. I'll go ahead and hook up my syringe and then draw the desired amount. Today I will be demonstrating how to draw blood on the cephalic vein of a cat. So I have my coworker restraining and holding off on the front leg. What I'll do is spray some alcohol. I have my butterfly ready. And you can see the blood flowing nicely. I'll attach my syringe, and then once I get the desired amount I need, I'll go ahead and come out, and then my coworker will apply pressure. Today I'll be demonstrating how to obtain a blood sample from the jugular of a cat. So we have the legs drawn down. I'm gonna get my needle ready. You can see the blood's drawing back, so I'm going to go ahead. So today I will be demonstrating how to draw blood from the medial saphenous vein of a cat. So I'll go ahead and get my light on. And my coworker is restraining and then holding off on the leg. It's okay. It's okay. Go ahead and part the hair. I have my butterfly ready and my syringe and some tubes to put the blood in after I get the amount I need. So I'll go ahead. And you can see the blood's flowing nicely through the butterfly. I'll attach my syringe up. And then once I have the amount I need, I'll go ahead and pull out my butterfly, and my coworker will apply pressure. The minimum databases that are used before a surgical procedure are the PCV, the total proteins, BUN, ALT, blood glucose. The PCV is important to check for red blood cell production. If it's low, it could mean they're anemic. The BUN and ALT give us insight into the liver function of the patient. The total protein, total solids test gives us insight to the plasma protein levels. Blood glucose also gives us insight into their endocrine function, their pancreas. Some of the other databases we use here, we do a complete blood cell count, checks for the red blood cells, white blood cells, hematocrit or PCV as well. We also do a total chemistry panel, which not only checks the ALT, it checks the ALK phos, other kidney and liver values. We also do the electrolytes as well. If we're looking at a patient who has a much higher risk of going under anesthesia, we'll do an even more comprehensive. For instance, if we are doing a procedure on a patient that has never had a surgical procedure before, we also do test their coagulation profiles. We'll do a PT and a PTT, which tests for 2 different pathways of the clotting cascade in a patient, and if those levels are abnormal, we will postpone surgery and dig further into the issue of the patient. If their white blood cell, red blood cells are abnormal, if their chemistry is very abnormal, we will not do the procedure. We may do even more testing. We may do radiographs, and we might even call in a radiologist to do an ultrasound of the abdomen to check for any tumors on the liver, any hinting of any sort of cancerous process in the patient. We also routinely run fecal diagnostics, fecal tests to check for any intestinal parasites. We also do heartworm tests to check for any tick-borne diseases as well as heartworm disease. If we have a puppy who is showing signs of lethargy, vomiting, and we're concerned about parvo, we will also do a parvo test. We also have CPLs and FPLs to test for pancreatitis, and we also have pro-BNP tests. For the procedure first discussed in this video, a dental procedure for an older geriatric patient, we pre-medded with hydro and midazolam as our beginning of the anesthetic protocol. We will then induce with alfaxin, which has a very high safety margin. It has less respiratory disadvantages than propofol. So pre-medding with those things provides analgesia before we even begin the procedure. These also allow us to use less gas anesthetic, and we will monitor her closely during the procedure so that if her blood pressure is going down, we may increase fluids. We may also decrease the gas level she is on. But pre-medding with all those other medications allows us to not use as much gas anesthetic and provides a safer procedure for our patient. If indicated by the doctor, we may give a anti-inflammatory injection before the procedure is over, right at the end, to get ahead of any inflammatory processes from either extracting teeth or any other painful part of the procedure. So today I will be demonstrating how to log a controlled substance into our control log. So I have our surgery report up for the day, and you can see we used 0.3 alfaxin. So I have the page already up. It has all the expiration dates, the invoice number. So I'm going to log it. Today's date is the 12th. And this was for POCUS. And he's in a rescue, so I'm going to write rescue P to Lion's Heart as the last name, and we used 0.3. So now I'm going to take 0.3 from the amount remaining, and that the total will be 7 mLs, and write the doctor's initials. Now I will be going over properties of our anesthetic machine. First, we can see that behind here we have our size H oxygen tanks. They are attached to the wall, and you can see we have 2 of them, and it's flowed up to our line pressure system, and then we have these tubings through our ceilings in certain places of the hospital that will attach to the anesthetic machine. I have a rebreathing circuit attached now. You can see that this is the pop-off valve, and when we want to give a breath to the patient under anesthesia, we'll go ahead and close it off. And using the reservoir bag, we can give them a manual ventilated breath, but then it's very important to open this back up because that will cause an excess accumulation of gas in the patient, and this allows the gas to flow freely. Here we have our flow meter. So when our oxygen is on, we can set the flow meter to what we need for each breathing system. For a rebreathing system, it is set to 1.5. And because we have a sphere, the top of the sphere will be at the line, which is what level it's at. For a non-rebreathing system, we go up to the 2. You can see here this came off. But now we have both of our inlet and outlets attached to our vaporizer. We have an isoflurane vaporizer and a sevoflurane vaporizer. These take in the gas in the liquid form, the anesthetic in the liquid form, and then it'll vaporize as oxygen goes through. So it's very important to only use each respective gas in the vaporizer. If another gas is put in an opposite vaporizer, we will have to send back the machine. It can be very dangerous for the patient. It is not recommended. You can see we have our breathing circuit. This is attached to the exhalation valve. This is attached to the inspiratory valve, and you can see this is an F circuit. So each breath inspired is warmed by the exhaled gas and oxygen, and that's another way to keep the patient's temperature at an appropriate temperature during the procedure. We have our reservoir bag here, and this is any extra accumulation of their breaths and gas, and we can during the procedure we can ventilate the patient, give them an extra breath like explained earlier. You can close off the pop-up valve, and then let's see. And this is the pressure manometer. We never want to exceed over 20 cms because that can cause damage to the patient's lungs with that high of a pressure. This is our soda lime container, which will absorb any CO2. We check these after 80 hours or after a total of 8 hours of time on this machine to make sure that the soda lime hasn't changed color, which means it's done absorbing carbon dioxide, which means we need to change it to fresh granules. This is the oxygen flush valve. So if I press this, a flow of fresh, pure oxygen will be ventilated to the patient. This can be used for a leak test. Or if we need to help the patient breathe and we want to give them a fresh flow of oxygen, we can use that as well. The exhalation and inhalation valve are set up on this machine when the patient inhales. The scavenging system we use is the exhaust valve tubing is connected, and we use F-airs. So these are measured. You can see we weigh them after every procedure. So if we started out at 206 grams, after this has had a 50-gram increase, we will put on a new F-air, which means it has taken in as much waste gas as possible. You can also attach a mask to the end of this. If we weren't using a mask, this would be attached to the endotracheal tube of an intubated patient. So this mask can help further knock down a patient if they're having trouble with the induction agents we were giving intravenously. We can mask them and they can breathe in the gas anesthetic. And now to change this to a non-rebreathing system. A rebreathing system is used for medium to larger dogs. So I'll go ahead and take these off. I'll replace this outlet connection with the outlet connection for the non-rebreathing system. Then I'll attach this to the F-air as well. So then here, instead of using this on our system, I will use this to give them a manual breath. So I would close this and squeeze this gently for the non-rebreathing. Non-rebreathing systems are used for feline patients and smaller dogs. Now I will be performing how to perform a leak test on an anesthetic machine. I have set up a non-rebreathing system, so I'm going to go ahead and close off this chamber. And now I'll turn the oxygen on and block this airway so that you can see the bag is now filling up. Once it's filled, I'll go ahead and turn off the oxygen, and I'll hold this for about 20 seconds, and you can listen for any leaks. If you hear a hissing sound, that could mean there's a hole in the bag or the line. You can see the volume is not decreasing. I don't hear any hissing at all. I don't feel any air movement. So now I'm going to go ahead and let go. You can see it'll deflate. Now go ahead and turn it back onto the open. So today I will be demonstrating how to place an esophageal stethoscope. We do not have any in our practice, so I will be using a red rubber catheter in place of it. If it was an esophageal stethoscope, we would either have a machine that you could hook up to, or you would be listening to it with your hooked up to the end of your stethoscope. So with the placement of it, you want it to hit just where the heart is. If you go too far, it would be muffled with lung sounds, and if you're not far in enough, you wouldn't be able to hear a very good heartbeat. So he's on his side, he's already intubated, which prevents us from going into the trachea. And I have some lube on the end. You can see this far in, and then once we are done, we'll just take it out. So today I'm going to be talking about some pieces of equipment used during a surgical procedure. Here we have our EKG machine. It's not hooked up to a patient right now. Later in the video you will see this hooked up to a patient. These are the leads that will give us our EKG reading. The white lead goes on the right forelimb, the black lead goes on the left forelimb, and the red lead goes on the left hind limb. You will then see, once they're hooked up to a patient, a nice EKG reading that will give us insight as to if there's an arrhythmia, any tachycardia, bradycardia. We also have our pulse oximeter, or our SpO2 reader. This goes on the tongue or the ear, and this will show us the amount of oxygen being brought through the blood in the hemoglobin, which is a very important indicator. If the level goes below 97, that is a cause for concern. We also have here shown up will be our respiratory rate as well. It's always a good idea to manually check the respiratory rate, either watching them inhale and exhale, or in the ET tube you can see the breaths they take. This is an endotracheal tube. This is what we use to intubate the patient. That gives us a nice clear airway to provide oxygen and gas anesthetic. So in order to ensure that our ET tube is ready to use, we always want to make sure that there's no leaks or holes. So you blow up this part of the cuff, and this will stay. If this stays for a couple of minutes, we know we're okay. In order to size them, you can pull them up to the nose by weight. It's always a good idea to have multiple sizes out in case when you do visualize the trachea, you need a different size. There's also here our blood pressure monitor. There is a hookup on our EKG machine, but we like to use the Doppler. So there's a nice crystal here. We'll use some ultrasound gel, and then we have our cuff, and we will use this monitor to get our blood pressure reading. I'm going to be demonstrating now how to use a temperature monitor during surgery. I have my probe here. This is a pre-surgical temperature before we get started. Put some lube on the end. So we're a little cold. I'm going to be monitoring that closely during surgery. If his temperature continues to drop, we'll definitely need a bear hugger for recovery. So I'm going to be introducing my preceptor, Dr. Reeds, who's been helping me this semester. So today I will be demonstrating inserting an IV catheter in the cephalic vein of a dog. So I'm going to go ahead and first shave the leg. Come around both sides. Hexidine scrub. Then I'll spray some alcohol in the vein as well. And you can see the vein is popping up nicely from my coworker restraining and occluding the vein. And I have my 3 pieces of tape here. I'm going to go ahead and get my cap ready. And I've already flushed this catheter. We're going to be inserting a 22 gauge catheter. You want to make sure the bevel is facing up. And then you can see the blood advancing. I'll go ahead and place my cap. Now with my first piece of tape, I'm going to take the adhesive side up, go under, make a loop. My second piece. Good job. My vet wrap. Then I'll take my flush and just make sure that my catheter's in. Yes. Okay. Today I'll be demonstrating how to place a catheter in the saphenous vein of the dog. So I'm going to go ahead and clip my site. He has very, very short hair. You want to make sure to get around each side of the leg. I'm going to take some gauze that's been soaking in chlorhexidine. That'll sanitize the area. And then I will go ahead and have my coworker hold off. So I'm going to be using a 22 gauge catheter, and I have my tape already set out, and I'll have my cap as well. I'm going to go ahead and get that ready. So using my thumb to stabilize the vein, I'm going to go ahead and insert. And you can see that blood is flushing through, and now I will go ahead and push my catheter off the needle. When I take it out, I will put my cap on. I'm going to put the first piece of tape, sticky side facing up, and put a piece of tape over there, and then I'll go ahead and flip around. This is going to anchor my catheter. And then I made a little safety tab so that it's easy to pull off if needed. My second piece of tape is thicker, and that's going to go directly under. Come around. I'll go ahead and still do another safety tab. And then my last piece is going to go sticky side facing up under the catheter. That'll just further secure the catheter to the leg. And then before I put my vet wrap on, I'm going to go ahead and flush and make sure I can feel. And I can, and then I can pull back and you see the blood in there. I'll go ahead and tear a piece of that. Just do the small piece of that wrap around the leg. I'll be demonstrating how to give a subcutaneous injection. I'm going to be giving Medicam, which is an anti-inflammatory. So bevel up. I'm going to go ahead and pinch the skin and get a nice tent. I'm going to pull back and then push the medication in. So today I'll be demonstrating how to give an IM injection. This will be our pre-med for the procedure we're doing today, which is a combination of hydro and midazolam. So I have my coworker restraining. I'll go ahead and feel. Back. Just push in. That's it. I will be demonstrating how to give an IV injection. For the purpose of this video, I'm just going to be using sterile saline. So I'll pull some up into my syringe. I have my coworker occluding the vein, so I'll spray alcohol. Now once I'm in the vein, she'll go ahead and let go, and I will slowly inject the saline. So first we are going to be using alfaxin as our induction agent. We chose this because of its short duration and high safety margin. So I'm first going to draw up the 0.3 mLs. I'll grab a flash with me. And then we use this to effect. So I'm going to administer this slowly, only as much as the patient needs before we can intubate. And then if he has a nice relaxed jaw tone. So since I am not a licensed technician in the state of Maryland, I cannot legally intubate, so I'm going to switch with my coworker who is a licensed technician, and she will be intubating. We already have our pre-chosen tubes out. You can choose the tubes based on weight, and it's a good idea to get multiple sizes, smaller and larger, just in case when you visualize the trachea you need to get a different size. So first she's going to have her tie ready, and I'm going to scruff, lift, and she will pull the tongue out, and then using a laryngoscope will push down and visualize the trachea. So push the ET tube in, take out the laryngoscope, and now we're going to immediately hook up to oxygen and gas. And she'll be inflating the cuff, which will inflate the cuff that's in the trachea. And a good way to check for any leaks are if you smell any gas while you're tying in the tube, if this starts to deflate. Now we're going to unhook, place him on his side. And then she's going to listen to each side to make sure she hears equal breath sounds, to make sure the trachea or the ET tube is placed properly. So now that our patient is intubated, I'm going to go ahead and apply the eye loop. Now I will be demonstrating shaving the surgical area as part of the preparation for surgery. The incision is going to be made right along here, so I'm just going to shave an even square around the surgery site. And I'm using a blade only used for surgical procedures. And I'm gently pulling the skin back. So now that we're done shaving, I'm going to go ahead and use a lint roller to get any excess hair off of the surgery site. And now just to check, I'm going to check his bladder. We're not doing an abdominal surgery, but just to see, his bladder's not full, so I don't need to worry about expressing it. And now I'll go ahead and do a pre-surgical scrub. We're going to be using the bullseye scrubbing pattern. And now we're ready to move into surgery. I'm going to be moving the patient into surgery. I'm going to be careful not to touch the surgery site. Get him hooked up to the anesthesia machine. We are going to maintain on isoflurane 2, the oxygen. And now I'm going to come around the other side and tie him to the table. And this ensures that he's not going to be rolling around during surgery. He's in a stable position. Do this side. And I'm positioning him in dorsal recumbency for the neuter, which is how the doctor prefers it. Now I'm going to be demonstrating how to do the final scrub before we get started with surgery. I'm just going to be using chlorhexidine today because we do use a surgical laser. If we were doing a traditional scalpel, if we were going to be using a scalpel instead of the laser, we would alternate between alcohol and chlorhexidine, but because we are using the laser, I'm just using the chlorhexidine. I'm again going to be doing the bullseye preparation. 3 times. So now I'm going to be demonstrating monitoring during a procedure. I have my sheet here. I'm taking my vitals. You can see the mucous membrane color, the CRT, pulse, respiration, SpO2, what gas we're using, what level we're on, temperature, and blood pressure. So here we can check by peeling back the gum. You softly press. You can see it refills very quickly, which is good. His mucous membranes are nice and moist. We are using the Doppler instead of the attachment for the EKG machine, so this will be our blood pressure. So I would say about 86 is our blood pressure right now, which is good. And then you can see we have our BPM, beats per minute, up there. We have our SpO2 in blue, which is 98, which is great, our pulse rate. And then we have our respiratory monitor here. It's always better to double check manually instead of just relying just on the machine. So I'm going to go ahead and just turn down the volume of this and listen. So I am getting 100 for his heart rate. And he is breathing pretty rapidly. To get the respiratory rate, you can either look at the ET tube, and sometimes you can see the breaths in there, or by feel or listening. So then I got 20 for his respiratory rate. Additionally, on my surgery report, I have the fluid rate he's on right now. I also have when he was intubated, when we started the procedure, any emergency drugs, and then during recovery, how was the recovery. We'll do a pain assessment score, and I'll do the total volume of fluids. There are some attachments on the EKG machine that we don't use, but they are there if we would need them. He is hooked up to all the leads for the EKG machine. He is draped and the procedure is going on right now, but the black lead is attached to his left forelimb, the white lead is attached to his right forelimb, and the red lead is attached to his hind left limb. And the SpO2 monitor is hooked up to his tongue. You can also use the ear if you're not getting a good reading from the tongue. Now I will be demonstrating how to perform CPR on a patient. I'm using a stuffed animal now. So since this would be a smaller animal, I'm going to be doing one-handed compressions with the feet facing away from me. I'll wrap one hand around the chest, and you compress to the song Staying Alive by the Bee Gees, so you achieve 100 to 120 compressions per minute, and you allow full elastic recoil of the chest before the next compression. So you first start doing chest compressions for 1 to 2 minutes. If you're alone and you can't intubate yourself, or if intubation is not feasible, you can then take a brief pause after 30 seconds of compression and give mouth to snout breaths. So I'll take a pause and then go back. The ratio of breaths to compressions should be 30 to 2. So every 30 chest compressions, you will do 2 breaths. Now, if intubation is feasible, or if they're already intubated, you could use an ambu bag. I don't have an ambu bag right now, but I'm going to be using part of a non-rebreathing system just for demonstrative purposes. If this patient was intubated, I would attach the ambu bag and give compression and give breaths of room air to the patient while someone else or myself was giving chest compressions simultaneously. The next step in CPR is hooking up an EKG and getting an end tidal reading of carbon dioxide and oxygen. So that would be the next step. The other step is any reversal agents, getting a catheter in, hoping to stimulate the heart to beat. It is preferred to have an anesthetic machine being able to give the patient 100% pure oxygen, but if that's not feasible, room air is acceptable. Today I will be demonstrating how to scrub in as a surgical technician for a canine spay. So first I'm going to open up a pack and get that ready. You can see that I have removed all of the jewelry from me. I have the cap and mask already on. So go ahead and open this. Now I'm going to start the scrubbing process first with the pre-wash. So now that I have washed my hands, getting any dirt or debris off, I'm going to go ahead and use the pick provided to scrub under my nails, getting any other dirt or debris. So now I'm going to start scrubbing. I have a scrub brush already provided filled with the chlorhexidine solution. I'm going to be using the bristle side and first scrubbing the tips of my fingers 10 times. And now starting with my index finger, I'm going to scrub each surface of my finger 10 times. Making sure to get in between my fingers. And now I'm going to move to the palm of my hand and scrubbing from the base of my fingers down to my wrist. And then I'm going to move to my thumb. And now when I'm on the last side of my thumb, I'm going to scrub down the surface of my hand as well. And now I'm going to scrub from the base of my fingers to my wrist. And now I'm going to scrub from my wrist up to my elbows, getting each side of my forearm. Okay, now I'm going to move to my second hand. I'm going to start with the bristles under my fingertips. And then move from my index out to my pinky. Now I'm going to move to my thumb, or now I'm going to scrub the palm of my hand from the base of my fingers to my wrist. Now I'll go ahead and move to my thumb. And now that I'm on the last side of my thumb, I will again go down the base of my hand as well. And now I'll go from the base of my fingertips to my wrist. And now I'll go each side of my forearm again 10 times. So now that I've done the first scrubbing, I'm going to go ahead and wash my hands, making sure that my hands don't go below my elbows and that the water is going to run off down my arms. Being careful not to touch anything, I'm going to go ahead and do the process over again. Now I'll move to the palm. And now I'll go ahead and move to the thumb. Now I'm at the base of my hand. And now I'll go from my wrist to my forearms again, to the elbows again. And now that I'm done with this arm, I'll go ahead and move over to the second arm again. Now that I've completed 2 full scrubs of each arm, I'm going to go ahead and then do my final wash. Making sure the water runs down my arms and being careful not to touch anything. So now that I've scrubbed, I'm going to go ahead and get my gown on. So first I need to dry my hands and arms. Using the sterile towel that's provided, I'm going to pick it up by the corner and then drying using, not rubbing, but going around each digit. Now for the other hand, I'm going to pick this towel up by the other side, then do the same thing. So now I'm going to open up my gown, picking it up by the corners. I'm going to visualize the armholes. And once I have the gown on, I will be careful not to push my fingers or hands through the cuffs of the gown. So now I will be demonstrating the closed gloving method. An assistant has tied me in, so I'm going to go ahead and open the gloves, not allowing my fingers or my hand to pass through the cuffs of the gown. So now taking my left hand, I'm going to place the glove for my right hand over my palm, fingers facing towards me, thumb to thumb, and with my fingers inside the cuff with my left hand, I'm going to grasp each side and pull it over my hand. So now that my fingers are in each finger hole for the glove, I'm going to go ahead and lower the cuff of this glove. Now, doing the same thing for my left hand, and now I'm ready to go into the surgery suite. The duties and responsibilities of a sterile surgical technician are to assist the doctor in any way during surgery, passing the instruments, organizing the instrument tray, blotting or moistening the tissues as needed. To moisten the tissues, you would need to use lap sponges that have been sterilized, soaked in sterile saline. To maintain sterility, you need to stand with your arms in between your shoulders and waist, not going below or above, with your hands clasped in front of you, making sure not to touch any non-sterile equipment. If sterility is broken, you need to re-sterilize immediately, meaning having a non-sterile technician open up a towel and gown pack for you, get a pair of gloves ready for you so you can go re-sterilize and come back into surgery. So one of the roles of being a surgical technician is blotting the surgery site or organ if needed. So I'll go ahead and have a gauze ready. So now I'm going to be passing the doctor hemostats. Now we'll be passing the doctor the blade holder with the blade on it and then a pair of forceps. So I'm going to have the blade face towards me and pronate to the angle in which the doctor will need it. And then I will have my coworker drop the blade into the pack so that I can load the blade onto the scalpel handle. Using hemostats, go ahead, place the blade onto the scalpel handle. So today I'll be demonstrating opening the surgical pack, preparing it and organizing it for the doctor. So I'm going to go ahead and open the first drape, or the second drape on the pack. I'm going to go ahead and take out the indicator strip, and I'm going to orient the pack to the doctor's preference with the instruments facing her. And then I'm going to drape the patient, so I will take the drape. Placing it over the correct area. Because of the drape size, I'm going to go ahead and tuck the edges in. Okay, so I went ahead and folded the drape just slightly to cater to her size. Now I'm going to clamp each corner. So one of the roles of being a surgical technician is blotting the surgery site or organ if needed. So I'll go ahead and have a gauze ready. I'm going to go ahead and take out the spade hook from the pack, and then I will have my coworker drop the blade into the pack so that I can load the blade onto the scalpel handle. Using hemostats, go ahead, place the blade onto the scalpel handle. Now we'll be passing the doctor the blade holder with the blade on it and then a pair of forceps. So I'm going to have the blade face towards me and pronate to the angle in which the doctor will need it. And then take these. Okay. So now I'm going to be passing the doctor hemostats. The duties and responsibilities of a sterile surgical technician are to assist the doctor in any way during surgery, passing the instruments, organizing the instrument tray, blotting or moistening the tissues as needed. To moisten the tissues, you would need to use lap sponges that have been sterilized, soaked in sterile saline. To maintain sterility, you need to stand with your arms in between your shoulders and waist, not going below or above, with your hands clasped in front of you, making sure not to touch any non-sterile equipment. If sterility is broken, you need to re-sterilize immediately. meaning having a non-sterile technician open up a towel and gown pack for you, get a pair of gloves ready for you so you can go re-sterilize and come back into surgery. So today we are performing a cryptorchid neuter on a canine. I have scrubbed in and I am standing by in case any help is needed by the doctor. So today we are performing a feline neuter. I have sterile gloves on and I'm just standing by in case the doctor needs me. Now I'm going to be demonstrating how to clean the surgical suite after procedure. First is to get all the equipment put away and cleaned. So I'm going to start by taking the things for the EKG. Turn off the machine. I will spray the edges down with chlorhexidine. Just give that a wipe. I'm going to just put them black. We roll them up nice and even around the machine to keep it secure. Okay, I'm going to set that aside. Now I'm going to go ahead and get my Doppler put away. For the Doppler, when you wipe down the crystal with the gel on, you always want to make sure to wipe it down with gauze, something soft. You don't want anything abrasive to damage the crystal. Put the cover on. Go ahead and set this aside and get it charged. Now I'm going to take any dirty surgery laundry, drape, any trash, extra gauze. And now I do have a sharp here, so I'm just going to pick up this with the needle holders and place it in the sharps container. Set my instruments aside, and in the next video I will show you how to properly clean instruments. So here's the surgery laundry. I'm going to set that aside. So now we did give an injection of an anti-inflammatory, so I will put this away in the cabinet. Now I'll take this towel, place it to the side, and then we're going to want to wipe down the table, hot water blanket, and then the mayo stand with the chlorhexidine solution. I'm first going to wipe down this. Fold it up. I set this down. And now I can spray down my surgical table. And this is just to make sure you get any extra hair or debris off. Flip this over. Now I can set this aside. I'm also going to put away the surgical light. Set that aside. Do another wipe down. I'll wipe down my EKG. And now I'll remove all the extra things from surgery and show you how to sweep and mop after. So now I'll be wiping down the rest of the equipment in here. I'm just going to spray some chlorhexidine onto my towel. I'll just do a wipe with the anesthetic machine. This just prevents any buildup of debris or contaminants. Flip that. Then I'll do my fluid pump. And then I can go ahead and wipe down the trash bin, the sharps container. The next step of cleaning the surgical suite after a procedure is sweeping any debris out. If you have a high volume of surgeries, you can use a vacuum. I'm just going to use a broom because we only had one procedure today. So I'm just going to go around the room and make sure, move around equipment and get any debris out. So the next step in cleaning the surgical suite is to mop after you swept and wiped down all the equipment. You want to make sure you are using a designated mop and bucket just for surgery. And then you want to make sure to use a good disinfectant like bleach, which is what I'll be using today. Start on the far end and work my way towards the door. step in cleaning surgical instruments is to let them be in a pre-soak. So I'm going to take some fresh distilled water, and I have the instruments in this bowl. I'm going to fill it so that they're all covered. And next I'm going to make sure that all of the box locks are unlocked. They're all spread. And this soaking just helps loosen any debris or dry blood that's on the instruments in surgery. So now the next step in cleaning the instruments is scrubbing. So I have a soft bristle brush and then I have a hard metal one. The hard metal one you only want to use if there's really some stubborn debris that's stuck. Usually you can just use a soft bristle and brush while in the water. You want to make sure you clean that all through the lock. And if you were to use the soft bristle, you'd want to make sure to go with the lines. You don't want to go opposite. That could damage the instrument. Just go like that. So now that I've finished cleaning the instruments, it's time to put them in the ultrasonic cleaner. I have my cleaner pre-diluted based on the manufacturer's instructions. So I'm going to go ahead and fill up my ultrasonic cleaner. And now when placing the instruments in the cleaner, you always want to make sure they're open, they're not locked, so that every surface area can get properly cleaned. And you don't want to overcrowd the cleaner either. There are some cleaners for the ultrasonic cleaner that come with a lubrication added in. This is not the case for this cleaner we have here. So after they're in the ultrasonic cleaner, I'll go ahead and remove them and place them in the lubricant. Okay. This is set for 15 minutes. So now that my instruments have finished cleaning in the ultrasonic cleaner, I have my lubricated distilled water right here. So I'm going to go ahead and move the instruments into here. And these will soak in the lubricant for about 20 minutes. You want to make sure they're fully covered and each one of them is still open. Now that the instruments have been soaking in the lubricant for the allotted amount of time, I'm going to go ahead and take them out. And then you need to make sure when setting them out to dry that they're completely open, which will prevent any water from staying within the box lock, and then they'll dry faster. You set them out spaciously. And then in about an hour or so, I'll come back and flip them so that the other side is gets a good amount of time to dry. Now I will be demonstrating how to prepare a surgical pack. So I have my tray. I'm going to lay a towel in here. And now I already have my instruments set out. We do have lists of each general pack we use, what instruments are needed, and I have double checked that we have everything we need. So first, I'm going to start by, to make sure that the instruments are neatly organized in here, I'm going to put them through my thumb and forefinger just to keep them in order, and making sure none of the locks are open or are locked. You can see they're all open, which ensures that Every part of the instrument will be sterilized. Now I'll put my spay hook through these to make sure they don't slip and fall. And now I will go ahead and lay them in the pack, still making sure that none of them have locked up or closed. We have some gauze in here that will be sterilized that the surgeon can use during the procedure. And I have the towel clamps. Go ahead and place these like so, attached to each other so they're easy to find for the surgeon. Now I also have the forceps and the blade holder that I'll place in here. Next we have our drape. So this drape is already folded in accordion style. So I'll place this on top. And now I will put in a piece of indicator tape. So this will give us a second assurance that the pack has been thoroughly sterilized. Fold it so that when the surgeon opens, the first one will fold towards them and the second away from them. Now these surgical packs are double wrapped in drapes. So I'll take the first drape, I'm sorry, the inside, they should they should unfold the towel away from them the second time. So I'll take this one. Making sure I have nice tabs for a surgeon to open smoothly. Now I'll take my second drape, which this outside drape will be opened by a non-sterile technician, leaving the second drape inside to be opened by a sterile surgical technician or the sterile doctor. And now I will secure the pack with tape, like we did with the gown pack. I'll put a piece of this indicator tape on there as well. This will also ensure us that the pack has been thoroughly sterilized. And we color code our instruments, so I'm going to call this the orange pack. It has all the instruments that have orange tape around them. I will also write my initials, and I will put the date. Now I will be demonstrating how to wrap a gown pack. So I have my clean gown here, and I have my supplies waiting over here. So first, I'm going to make sure that it's not inside out. I'm going to lay the gown on a flat surface. I'm just using the surgery table. And now I'll take the sleeves, fold them neatly like this. The goal of wrapping these packs is so when the surgeon or surgical nurse takes them out, they open it in an accordion style fashion. They don't have to wrestle it open. It's easy for them to get open, visualize the armholes, and put them on. Now I'll take this edge fold it halfway. Take the other edge, fold it evenly. Now we'll go ahead and take this side again, fold it one more time, as well as this. And now what I'll do is take both ends and fold them the opposite way. So now when they open, it'll just fall open smoothly. And now I'll finish folding it accordion style, like so. Leave the strings out. So now there's that. I have a drape. And then I have a towel that's already folded accordion style, and this is used to dry their hands after they're finished scrubbing. I will place the gown in the center of the drape, the towel on top. And now I'm going to use a piece of indicator tape that I'll set on top of here. This will tell us that the entire pack has been sterilized through and through. I'll also be using indicator tape on the outside, but this gives us just an extra it gives us extra confirmation that the pack has been properly sterilized. So now I have that. I'm going to take this side away from me first, pull tightly, fold back a tab. Now I'll go to the right, do the same thing, making sure there's a tab. Then I'll go to the left, make another tab. And now with my last piece of the drape, I'll go ahead, pull it over and fold it into this last tab. And this allows the surgeon or surgical tech to open. It'll fall out nice and easy. The last tab will be taken away from them. And now I have my tape. It's important to make sure the pack is secured. If the tape's too long, you can rip off another piece, make a safety tab. And now I'll take my indicator tape, place a piece on here, and now it's important to write what pack you just wrapped. So I'm going to write a towel and gown pack to let whoever is opening this that there is a sterile towel in here. I'll write my initials and then the date. So we have a gravity air displacement sterilizer. This uses distilled water in the bottom of the autoclave, which will then turn into steam as the temperature rises. Maintaining an autoclave is very important. It's a essential piece of equipment for a veterinary hospital. It ensures the sterility of every instrument and pack used here. So usually the sterilizer will come with a maintenance sheet, and this walks you through everything you need to do. For a general maintenance, you'll want to drain the distilled water from the sterilizer, and using a cleaner, you'll put a certain amount of the cleaner, well, you take the trays out too, you put a certain amount of cleaner on the bottom of the sterilizer, and you'll run a pouch pack, a shorter amount of sterilization, and before it dries, you stop it. And then even before that, we'll clean every part of the autoclave we can. We'll take out the trays, wipe them down, wipe the inside, make sure we clean all the little, there's 2 little filters that are in here that we'll clean as well. And it's important to follow the maintenance to a T. So daily maintenance, weekly maintenance, and monthly maintenance. This uses steam to sterilize the equipment or the instruments in the autoclave. Once the air has been forced out of the autoclave, the steam will force pressure to build until the optimum temperature is reached. Normally, the temperature should be between 250 and 270 degrees Fahrenheit. The pressure needed is between 15 to 27 psi, depending on what we're sterilizing. So here it has automatic settings on here. There's a setting for unwrapped, which could be if something fell during surgery and we need to flash sterilize it, this will do it very quickly. Pouches, which would be if anything was wrapped in a view reel. And then we have packs and hand pieces. And packs is what we're going to be using today. So taking the packs I had just wrapped, you don't want to overcrowd an autoclave. So I'm going to fit my general pack in here, but you can see that I would have to kind of shove this in here, or I can't really fit it down here, so I'm just going to be wrapping one pack today. You don't want to overcrowd because that could affect the sterility of the pack. So I'm going to close it, and then I'll go ahead and select packs. You can see it has it says 250 degrees Fahrenheit, and it says 30 minutes. So the whole cycle will take about 30 minutes. For the pack to be sterilized will take from 5 to 15 minutes. And once the optimum temperature is reached, you can see the steam escape the autoclave. So I'll go ahead and then hit start. And then it'll start to fill the chamber, and then the cycle will begin. Now that the cycle has finished on the autoclave, you can see that the indicator tape on top of the pack, the lines have turned black, which means the pack is properly sterilized. So today I'll be demonstrating how to remove sutures from a patient. We had a little laceration right here, and you can see the sutures are in purple. So I'm going to go ahead and take my suture scissors, go right under. Then I'll go ahead and take the rest out.